Too many people with a herniated disc in their lower back don't get better because they're chasing short-term relief at the expense of helping the disc heal properly. This makes a big difference between those that get better within a matter of weeks to months and those that are still in pain struggling years later. In today's podcast, we'll show you how to recover from an L4, L5 and L5 S1 disc herniation. We'll explain why it's happened in the first place so you can stop it coming back in the future. And we'll give you 3 strategies to not only provide relief right now, but help that disc heal for the long term too. If you're new here, welcome. I'm Michael Fatica, the lead osteopath and spine specialist here at Back in Shape, and we help people around the UK and all over the world fix their back pain and get back in shape for the long term. So let's begin with understanding what's happening down here in the lower back. And there are a couple of problems that we need to understand if we're to effectively heal this herniated disc. When you have an injury to any joint, let alone the ones down here at the L4, L5 and L5 S1 segments of your lumbar spine, you've injured the structures that maintain integrity of that joint. Therefore, this segment, whichever one is herniated for you, is going to be vulnerable. It's going to move in ways that have a little bit of laxity compared to the rest of the spine. And we have to appreciate this because the way in which the spine works relies, under normal circumstances, on equal tension through all of these segments, so the muscles can move the spine in different ways. A loss of integrity, i.e. a disc herniation, affects this mechanism and means that when you're moving around on a daily basis, you'll all too easily move in a way that focuses movement through that injured segment or that weak link in the chain. The second thing to understand is that when you have that injury, you're going to have a build of inflammation, which is a normal, natural part of the healing process, but you're also going to have a degree of stenosis happening. And what that means is, and it can be in different parts, but the disc, as it bulges out, occupies these little holes where the nerves come out of. So not only have we got the congestion and maybe direct pressure on that nerve from the disc, but we also have extra fluid being driven to this area by way of inflammation that congests this space where the nerves come out, giving us rise to sciatica or lower back symptoms. Fundamentally, whether we've got that disc actually pressing on the nerve and pressing it against the wall, or whether we've just got a build of inflammation occurring in that space, we're going to always have a degree of spinal stenosis occurring at the level we have the herniated disc. And this means there's simply less space for inflammation to build up before it creates enough congestion to irritate those nerves that go down the leg, giving rise to those symptoms that we experience. Unfortunately, now we've got a couple of things happening. We've got more inflammation in the area. We've got maybe some disc herniation in that space with this spinal stenosis, which means that the 2 holes that we've got where the nerve comes through are going to be smaller. And then we've got the role of instability that we mentioned earlier because there's an injury there. And that can mean that when we move in certain ways, that hole where the nerve comes out changes in size rather quickly, and therefore it pinches these little nerves that come out of the spine. And I'm only showing you this part because it's more difficult for you to see L5 on this particular model, but you get the idea. If we start moving around this vertebra, which this model doesn't do, you're going to start to pinch this nerve more easily, and this is where that instability allows this to happen and take advantage of the fact that we have the stenosis, we have the herniated disc there, and we have that instability as well. Before we get onto the strategies, it's worth just addressing one simple truth that catches out so many people. You're probably doing this stretch right now anyway, and that is rounding the lower back. That is taking our lumbar spine and eliminating and flattening out that lordosis to create more space. We've got tons of videos elsewhere on the YouTube channel and on the website that explain why this is a bad thing, but fundamentally, it is not helping the recovery process, and it is chasing that short-term relief that comes from stretching the muscles and opening out this space to relieve the congestion, but actually makes the healing process that's trying to take place, tightening this back up again, interfered with, and why you go around in circles and circles and circles because you're doing the classic knee hugs, the classic child's pose, and curling round forwards to try and relieve those symptoms. We have to stop that before we get on to the next step. And the simple truth is, we've had thousands upon thousands of members and patients over the years coming in to see us with herniated discs, bulging discs, etc. in the lower back, precisely this problem. And more or less all of them are doing these exercises just like you were before they joined the program or started working with us. And when you stop those, you can instantly start to get some improvement because you've ceased interfering with that healing process. And what you then do is get onto the stuff that we're going to talk about now to replace that bad stuff with things that are actually going to help that recovery process down there in the lower back. We get onto these two strategies here. The first one is going to be for relief, and that's relieving pressure on the disc, the pressure of muscle tension, and the pressure of excess congestion in that area of the lower back. We're targeting all three of these root causes of the problem, and we're going to be doing this ideally a couple of times a day. It is not cumulative. You have to do this a number of times to undo that stress and strain that's happening with daily life. And then you're going to get into the second strategy, which is more about long-term relief that accumulates session by session, week by week to get you better. The first thing we're going to do is to take pressure off that disc, because the herniation is caused by compression, particularly through the front part of the spine. And the great way we're going to do this is twofold. Number one, lying across the bed like so, we're going to have the natural lordosis backward bending curve drop in nicely. And we're going to use our arms to create this gentle stretch through the lower back, taking pressure off the lower lumbar discs. When you do this correctly, you'll feel a little bit of an achy feeling in the lower back as you pump with the arms, and that's going to be decompressing those discs. It's completely normal, and people often feel that similar thing when they're on the IDD table, the spinal decompression that we do here in the clinic. Aim to pump by pressing down into the side of the bed with your arms for around about 3 to 5 seconds, and then relaxing for 3 to 5 seconds. Repeat this 10 to 15 times before moving on to the towel decompression. For this decompression stretch, we're going to use a rolled up towel placed underneath the spine like so. We can gently lie on our back with our knees bent. We can do this on the floor or the bed if getting onto the floor is too difficult. We're going to lift our bum up off the ground, pop the towel in, and lie there for anywhere from 20 seconds to 5 minutes. When you finish the towel stretch, simply brace your whole spine and roll to the side. Avoid lifting, avoid twisting your back, because these things will be unhelpful. And give yourself a few moments before you get up. Don't just jump up and go and get the doorbell or let the dog out or anything like that. Give yourself a few minutes to get up slowly, walk around with nice, good posture, and then you can get on with your day. For both of these stretches, we have a full step-by-step tutorial. You can check that out, link down in the description, and just follow along to make sure you get all the finer points correct after this video. The next step is to mobilize the hips. And too many people make the mistake, like we discussed earlier, of rounding the back when they do things like a hamstring stretch, or arching the back when they're doing things like the hip flexor stretch, which we'll touch on in a moment. And these stretches are vital to keep the hips mobile so that the hips can do the work so that the lower back doesn't have to. And they're going to be pretty immediate. When you do a stretch, you will immediately have a little bit more range of motion. Unfortunately, in the early days, because there's still signals coming from down here in the lower back to those muscles, they will tighten back up. But that's why this relief routine is done multiple times a day with the other stuff that we'll get onto later. But note, when you are doing hip mobilization stretches, the hip is all that needs to move. The lower back doesn't. And bad technique means that most people will involve that lower back, which they shouldn't be doing, which means that you exploit the things that we touched on earlier, the instability and the inflammation and that spinal stenosis. And that's why you aggravate yourself when you've maybe tried these stretches in the past. When you do them correctly, with only involving the hip and without involving the spine, you'll find they actually work. So we talk about doing a glute stretch, a hamstring stretch, and a hip flexor stretch to work all three kind of main areas in the hips. And you can do these holding them for about 30 seconds. And there is a full step-by-step guide, again, linked down in the description, that you can follow along with. It's about a 10-minute hip mobility routine. Focus on maintaining a neutral spine throughout. And when you're doing the glute stretch, make sure you're not twisting or rounding your back. The hamstring stretch, the classic mistake is to round the back forwards. And with the hip flexor stretch, the classic mistake is to arch the back backwards. As long as you don't do those things, you're going to be A-okay when you're doing these stretches. The final step here is to manage that excess inflammation. And you can hopefully see how we're kind of addressing all of these points with this relief-based routine, whilst not compromising the structure of the lower back and adhering to the principles of a neutral spine when it comes to the lordosis of the lumbar spine. And what we're doing here is trying to manage that excess inflammation, because unlike the ankle or other areas of the body, inflammation, which is naturally a good process, can create congestion, which these bony holes can't manage. They can't stretch the same way the skin around your ankle can. So what we're going to do here is use an alternative or alternating heat and cold directly over the lumbar spine here. Yes, even if your symptoms are in the glutes or you've got sciatica, focus on the root cause, because this is where we're trying to manage inflammation. Using something like a hot water bottle or a cold pack and alternating these for 3 to 5 minutes of one, 3 to 5 minutes of the other, repeated for around about 20 minutes to half an hour, done at the end of this little step-by-step routine, will really start to manage everything much more effectively. We've got a full video again, just for a bit more detail on step-by-step use of contrast bathing to really help you use this great tool that doesn't have side effects, that's drug-free, effectively at home. As you're doing the relief strategy that we've just discussed, you need to immediately start this next strategy in tandem and have both of these running side by side. Why? Because the simple reality is, and we know from many, many people, that as bad as your herniated disc is, you're still doing stuff. You might be doing it with pain, but you're still doing stuff every single day. And if we do the right exercises in our strengthening, we can get some unforeseen benefits. Benefit number one is that we immediately make, like literally today, the exercises or movements that we're doing in real life safer and less problematic for our back. And that improves as you get better. And number two, which is what we're really looking for, is we actually strengthen the whole body. We strengthen the muscles and the spine and the discs at the level that's injured and around that level to give us lasting results. So step number one, we want to be as safe as possible, which is why we're going to do a modified dead bug. And if you can't get on the floor, you're going to do this on the bed. And this involves you simply lying on your back, engaging your core correctly, not rounding the back, not flattening the spine to the ground like you might have been told to do in the past in your Pilates classes or from your physio. We're going to stabilize that neutral spine, and then we're just going to have one leg going out and back in. There's a full guide underneath this video, linked down in the description, on how to do this exercise and even break it down to make it easier. But at its root, this helps us start to control for that instability. We're using the muscles that protect the lumbar spine to provide extra stabilization as we move one limb and the other. Why? Because most of life is going to be asymmetrical. Everything you're doing on a daily basis involves weight going more through one leg than the other, moving forwards and backwards. And if we can learn to stabilize the spine in the safest possible way, lying on the bed or lying on the floor with just the weight of our leg to negotiate, we can start to improve the ability to negotiate our spine in an upright load-bearing position. That brings us on to step two, which is starting to do some load-bearing exercises. And these will be things like the squat, the hip hinge, and slightly after that, the step up. Now, why the squat and the hip hinge? Because you are doing those every single day. You may have even done them while you've been sat or standing watching this video. You're going to get out of bed in the morning. You're going to go use the bathroom. You're going to sit down in a chair and you might still be going to work even though you've got a herniated disc. Learning to squat and hip hinge correctly gives us a safe environment in which we can start to practice the ability of controlling your spine with whole body movement. You will make some mistakes in these and the previous dead bug exercise, and that's okay. Your job is to maybe leverage some of the tutorials that we've linked to down in the description to learn to do them correctly in the safest possible manner. Because simply put, if you can't do them when you're 100% focused, standing there in your living room or wherever you are, doing your squat, and you can't maintain a neutral spine, then what hope do you have when you've got 101 things happening around the house, the kids, the dog, everything, and you're distracted carrying stuff? It's just not going to happen. And it needs to be mastered as quickly as possible so we get that technique benefit from day one. So when you're doing these, aim for around about 10 reps, and you might do 3, 4, or 5 sets of each of these. I would start with just mastering the squat and the hip hinge. Find the greatest range of motion that you can do without aggravating your pain. If you do this, then that's your starting point. It might be more for some and less for others. Some people, it's a very small amount of squatting or hip hinging that they can do. And once you've banked those two, we can move on to the step up and integrate that into our routine, where we're now dealing with one leg at a time in the load-bearing environment. Again, we've got tutorials linked down in the description, and also one additional tutorial that's going to really, really help you. And that's the tape test, whereby we put a little bit of tape along the spine here, and it gives us extra feedback when we're doing the squat, the hip hinge, and the step up to let us know if we failed and allowed our spine to move, which we might get away with from time to time, and especially as symptoms subside. But we must not let that happen, because as we then progress and start doing real life activities, start picking up the kids again, or carrying a suitcase, or getting the shopping, we're going to start to allow that weakness and that lack of control become exploited. And that is where these relapses come in. So use that tape test that we reference to really help you get it dialed in terms of the control of the lordosis. The final step here is actually starting to reintroduce weight. And we suggest the safest way to do this is starting out using bands, because on those particular exercises we just mentioned, it allows the virtue of the way in which a band works as you go down through the movement to make it a little bit easier and safer in that bottom part. Then progressing on to things like goblet holds, where you hold a dumbbell or a kettlebell up here, and then progressing on inevitably to using a barbell, which will allow you to use a little bit more weight. And the reason you need to do this is because your disc will only get as strong as you ask it to be. We've recently spoke to members on one of the live streams talking about daily tasks, because some people with the herniated disc go, well, I'm never going to lift again. And the reality is you will. You can either do it prepared or you can do it unprepared, as so many do, and then have a relapse. Know that if you've got kids, toddlers, babies in the family, you're going to be picking those guys up. They're going to be weighing anywhere from 10, 12 kilos. Some of the slightly larger ones are going to be weighing a little bit more than that. Your holiday suitcase is going to be 20 kilos. If you're going with a family, you might be carrying everything as the guys. So that's going to be significantly more. If you need to move a large plant pot in the house, or move the sofa, or pick up the Hoover, or carry the shopping, these things all have weight. So don't be unnecessarily worried about adding back in weight. It's all about how we do it rather than how much we use. And the big mistake a lot of people make here is they just use too much too quickly. And if you build it up slowly over a period of time, yes, starting with minimal weights on the bands or dumbbells and kettlebells, you will steadily find that you can add more and more and more over the weeks and months and years. And that last part might make you think, oh God, this is going to take years. The big thing here is that often this stage, this last step of adding in the weight, a lot of that is going to take place when you don't actually have the pain, or you have maybe 10% of your symptoms left. You need to continue doing that. And unfortunately, that's where most people fail. And they say, oh, well, I had a herniated disc again. It keeps coming back. It didn't work. No, your job as you get out of the woods in terms of the pain, it starts to go down, is to double down on your rehab and not forget about it, thinking, well, I don't need to do that anymore because the pain isn't motivating me to do it. You have to commit to this. That way you can really get stronger and safeguard that area of the lower back. Now, you can do all of this great, but remember, your rehab is going to take up a relatively small amount of the day. That early routine, the relief one, we're talking about around about 15 minutes at a time. And then we're talking about the work from a rehabilitation point of view, taking anywhere from 30 minutes, maybe an hour tops. And as you get further on in that process, you're only going to be doing this for something like 4 or 5 sessions a week. So it really decreases in its time commitment. The thing is, there are 168 hours every single week. And if you're spending no more than 6 or 7 of those actually doing stuff for your back, you have to acknowledge that there's a lot of other hours, even if we take out sleeping, that you're going to be spent using your body, and using your body in a good way or in a bad way. And the important thing is, and the reason that we chose those exercises specifically, is that you must apply that to daily life. It's no good doing a textbook perfect squat with 40, 50, 60 kilos, which might seem impossible right now, and then only going to round your lower back over as you're trying to pick things up off the floor or playing with your kids on the floor. You've got to start to use your body more effectively and more with the back in mind. And the upside of this is actually you've probably been using your lower back in a bad way, and it's actually come at the cost of your hip mobility, your knee mobility, and your ankle mobility and health in all of those 3 areas. When you start to incorporate this knowledge, use your hips and knees and ankles more and keep a neutral spine through more of your daily movement, you'll actually find the health of those joints is improved as well. And that's how you get the long-term results. You do the right relief strategies to help you manage the strain on that herniated disc. You build that with proper rehabilitative work that starts to strengthen your spine and rehab that herniated disc. And you make real life changes to the way you do things in the real world to make them more healthy in terms of not only your lower back, but your hips, knees, and ankles too. Ultimately, if you use this herniated disc that you're struggling with right now as a wake-up call to start to change some things, commit to strength and resistance work for the long term, learn the techniques and the foundational movements right to begin with, start to find the right resistance that you need to use to challenge your body and progress on for that long term, making changes in your everyday life, you're going to find that you can come past this herniated disc, no matter how long you've had it. And we've seen enough examples over the years, both in clinic and with members of the program, really turning things around and getting back to new levels of fitness and endurance as a result of taking accountability, taking ownership for that herniated disc and pushing on in the right direction with a little help along the way. Hopefully you found this video helpful. It did give you a few things to think about. Remember, you can always use that comment section down below if you've got any specific questions about the things that we've covered here. If you know someone else who's struggling with their herniated disc, consider sharing this video with them. It'll hopefully start to put them on the straight and narrow. And as always, thanks for watching, and we'll see you in the next video.